Whether you're dancing or driving, playing with a ball, or riding your bike to work, you're creating movement that's enabled to us by a structure within our spines, the spinal cord. This gift of movement is a privilege that we often take for granted. However, it can be taken from any of us in an instant. Acute spinal cord injury is a condition that occurs predominantly as a result of blunt or penetrative trauma. 105,000 people annually experience SCI. In Australia alone, 15,000 people live with the debilitating condition. 70% of all people that experience the injury require surgical intervention within 1 week, and SCI remains a common cause of permanent disability and death in children and adults. Given the severity of spinal cord injuries, it's only fitting that along with it comes immense economic cost. Australia alone spends $2 billion annually treating and managing the condition. Individuals with high cervical tetraplegia can expect costs of over $1 million in the first year, followed by $180,000 each subsequent year. Due to this high cost, those that cannot afford the necessary acute care and subsequent follow-up treatment generally yield to the complications and have a high mortality rate. Although it's clear that SCI produces enormous financial burden both on the individual and societal level, this burden is often overshadowed by that of the psychological distress brought about by the condition to the patient, their family, and community. SCI sufferers experience higher levels of distress and lower levels of life satisfaction on average. How a patient adapts to coping with SCI varies per individual. However, studies have firmly concluded that there are a specific set of psychological and social support factors that directly influence a patient's subjective well-being. Although there is no current permanent solution to reverse damage to the spinal cord, this is a rapidly growing field where new innovations in pharmacology and experimentation with other forms of treatment is highly prevalent. For this reason, this is a field where researchers remain optimistically hopeful. Advancements in all forms of medical treatment and pharmacology are occurring on a daily basis. This applies to SCIs. The acute treatment is as follows. Immediately preceding the injury, the first goal is to ensure that the patient is breathing correctly and that their heart is functioning properly. Cardiopulmonary complications are particularly a concern in suspected traumas on the high neck region. Patients experiencing these complications are treated with assisted breathing measures such as a breathing tube or ventilator. Once breathing is stabilized, the focus is shifted to immobilization of the spine. The objective of immobilization is to be as gentle as can be, and this is usually administered at the scene of injury. This mitigates the effects of secondary injury by alleviating as much pressure off the spinal cord as possible. Commonly, cervical collars and backboards are used to immobilize. Once the patient has been safely transported to a hospital, they often require immediate surgery for the removal of any tissue or fluid pressing against the spinal cord in a procedure called decompression laminectomy. Surgical intervention is also utilized to fuse bones or insert spinal braces. In the early stages of diagnosis, the patient is generally administered a high dosage of steroidal medication such as methylprednisolone, also known as Medrol. Such treatment needs to be initiated within 8 hours of incident to be effective. Additionally, prophylactic anticoagulation is administered within the first 24 hours. Anticoagulative drugs are administered to counter the high risk of deep vein thrombosis that patients encounter following an SCI. When trauma occurs, the white and grey matter that constitutes the spinal cord develop microhemorrhages, promoting thrombosis and vasospasms. All of this severely impairs neuronal homeostasis. Countering this damage to neuronal balance is the basis for the use of methylprednisolone or other steroids. Known for their neuroprotective properties, a speedy administration of such drug is correlated to significant long-term improvement of motor function. Moving on, weak respiratory muscles coupled with the inability to cough promotes respiratory infections such as bronchitis or pneumonia. Antibiotics are often prescribed to clear the chest cavity. Additionally, to combat spasticity, muscle relaxants such as diazepam and tizanidine can be administered. In addition to this, ample non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen are often prescribed to the subject to help with pain. further assisting in neuropathic pain relief, anticonvulsive agents such as gabapentinoids are also often prescribed. In recent times, non-steroidal anti-inflammatory drugs have become the focus of many experimental SCI treatment models due to their anti-inflammatory effects. Hence, this is a major area for future research that shows large promise. Other key areas for future research include mental therapy for improved coping, the use of therapeutic hypothermia, spinal cord stimulation, and the use of cell transplantation methods such as stem cells. So, it's undeniable SCI can be truly destructive, but as we have outlined, there are treatment options available for new innovations right around the corner. So, maintain a positive attitude and remember that where there is a will, there is a way to cope.